In this video, we will review universal teaching truths, which are derived from principles of adult learning theory and education psychology. These truths will help your teaching to be more effective and engaging for your learners. The unifying theme among all the universal teaching truths is that we learn what is important to us. We will go into more depth about what exactly this means for you and your learners in the coming slides. This brings us to truth number 1. We can only learn so much. In anticipation for a teaching session, you may be thinking, there's so much to teach them, but if I teach them everything, will they remember anything? The answer is no. How many chunks of info can people remember from any given learning experience? Basically 3 chunks of information. Make sure that what they remember is what's important. Identify a maximum of 3 learning objectives. These are your take-home knowledge points, skills, or attitudes. Your didactic should be built around these and emphasize them at the beginning, throughout, and at the end of the session. Be mindful of the scope of your lecture. If there's too much, it's hard to retain anything.
Moving on to truth number 2, check in and involve your learners. The only way to find out what people are learning from a lecture is to ask them. A major downside of lecturing is that learners vary in what they take away from it. They're probably learning something, but you don't know what. Cognitive theories of education state that we learn by building on our existing knowledge frameworks. Since these vary among learners, so too will their learning from your lecture. Ensure that learners are absorbing what you want them to by doing check-ins throughout the didactic. Pose discussion questions. Do quick writes, where you have learners write a 1 to 2 sentence response to a question, then hand it in to you and you can correct misunderstandings. Or offer quiz questions. These all help retain attention and ensure that learners are understanding what it is that you want them to learn. Finally, helping learners connect with and apply your main learning points in different ways increases their likelihood of retaining it.
Truth number 3, mix it up. Humans can't pay attention for more than 20 minutes straight. This is why TED Talks are only for this long. So don't go for more than 20 minutes without a soft break, such as a story, video, demonstration, or interactive activity. After 50 minutes, get learners up and out of the classroom. Time your presentation to the allotted didactic time. If you're running over time to finish slides at the end, chances are you've lost their attention.
Truth number 4, a teacher's job is to excite and engage, not just transmit knowledge. Our minds don't pay attention to boring. What signals importance to social learners such as ourselves? Our memory and attention are tied to emotion, humor, novelty, and storytelling. These are what tell our brains that information is important. When teaching, tell learners why you're passionate about the topic that you're lecturing on. Even if you've been asked to lecture on something that's not as interesting to you, think about what aspect of it is. Bring in emotion whenever possible. Like we're taught in therapy, follow the affect. Humor helps too. And teach something new. If your learners are likely familiar with the topic, make sure you're adding some new information or perspective. Lastly, stories. If you're comfortable, share a personal story related to the material, ideally involving some vulnerability on your part. If not, share an impactful patient story. Lastly, interactive activities, especially games like Kahoot, are emotionally engaging too.
Moving on to truth number 5. Minimize words on slides and maximize everything else. Engage learners in multisensory learning. Though we can multitask at some things, attention isn't one of them. Learners can't read your slides and truly listen to you, so which would you rather they do?
And if we're talking about PowerPoint, here is an example of a bad slide. It's busy, there's a lot of text, the pictures don't make any sense, and I'm now reading you this text about how much I hate this and I want to crawl into a hole, and you're probably reading it on the screen and trying to listen to me at the same time, which is just terrible.
Let's now take a look at a good slide. Isn't that better? For text on slides, less is more. Aim for no more than 3 to 5 bullets of a few words each on each slide. Many lecturers feel comfortable with text-heavy slides as something to fall back on, but this just diminishes you conveying your expertise. Whereas the average PowerPoint slide has 40+ words, TED Talk presentations have 20+ slides before the word count even reaches 40. Include no more than 6 objects per slide, objects meaning phrases or pictures. Beyond this, people have to count, which vastly increases cognitive load.
Back to a bad slide again. I know, it's not good. You're getting this now. It's becoming clearer. Blah, blah, blah. Text, 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 text. If it's not become clear already, lecturers reading slides, particularly wordy slides, is not engaging. Learners tune out when this happens, probably like you just did.
Use pictures instead of words whenever possible. Retention is increased sixfold when auditory information is paired with an image. It's a breath of fresh air. And use pictures that are surprising, beautiful, or even disgusting. Each slide should have a specific goal that can be summarized in one sentence. If it takes 2 sentences, make 2 slides. Better to have more slides with less on them. Use dark backgrounds, largest text for the most important part, and contrast of text and background to draw your audience's eyes to what matters. Also consider other ways to engage the 5 senses, maybe even bringing in a prop.
And on to our last teaching truth. Adults learn what they need to know, so keep it relevant. Didactics are often fundamentally in conflict with this principle, since they're less likely to be relevant to current or recent patients, as opposed to clinical teaching. But do what you can to make it relevant. Actively solicit questions, especially what learners most want to know about a topic, or ways this relates to their current work. Highlight connections to their work and provide specific advice. For example, the next time you're in clinic, ask all your patients to go through their cupboards and dispose of any old opiate prescriptions. Think about how and when learners will use the information that you're giving them. Lastly, try to think back to where residents are in their training and tailor your material accordingly. For example, residents often appreciate dosing information, especially earlier in training.
Remember, we learn what is important to us, so putting it all together, let's review our teaching truths. Number 1, we can only learn so much. Number 2, check in and involve learners. Number 3, mix it up. Number 4, excite and engage. Number 5, multisensory learning. And number 6, keep it relevant. We hope you found this overview of the universal teaching truths both practical and useful, and we really appreciate your attention so far. For those of you already abiding by these principles, wonderful and well done. We hope you will continue doing the same, and perhaps you will try out some new strategies for engaging learners. For those of you who are less familiar with these ideas, we hope these truths will provide you with a roadmap for how to make your teaching even more effective and engaging.